Dear professors and colleagues, it is great pleasure and honor to present in the international webinar on cardiology and cardiovascular medicine. This presentation is about the new advances and the innovations in the technologies and the devices in electrophysiology. First, we start by the electrodes used in ablation. The Biosense Webster multi-electrode balloon for radiofrequency ablation catheter. Each electrode can have varied power settings to avoid damage to underlying tissues like the esophagus. The second innovation is leadless pacemakers. One of the biggest issues with implantable electrophysiology devices is the leads that connect the device to the heart. Leads are frequently cited as the weakest component of pacing implantable cardioverter defibrillator ICD or cardiac resynchronization therapy CRT due to wearing out or complications due to infection. So the invention of pacemakers without leads is a new advancement. This is the leadless pacemaker. The presented concept involves the new change is implanting two units to stimulate both atrium and ventricle. So dual chamber pacing became available even leadless. The presented concept involves two leadless pacemakers that communicate wirelessly with each other and thus enable synchronized leadless dual chamber pacing. A novel technology is presented for pacemaker communication using the myocardium and blood as the transmission medium. To date, two leadless pacemakers are commercially available, Micram from Medtronic and NanoSteam from St. Jude. However, these devices have the significant limitation of performing single-chamber ventricular pacing only. So they invented two units. The presented wireless communication method may in the future also enable leadless cardiac resynchronization therapy. The concept proposed involves multiple implanted leadless pacemakers that jointly act as a leadless dual-chamber pacemaker system. This is the diagram showing the two units inside the right atrium and right ventricle and dual-chamber pacing. Also, this can be implanted in the left ventricle. Left ventricular pacing with the WISE CRT system. Illustration of device design and function used with permission from Ready. Cardiac resynchronization therapy with wireless left ventricular endocardial pacing published in 2017. The next innovation is subcutaneous ICDs. Boston Scientific introduced the first subcutaneous implantable cardioverter defibrillator system in 2009. Since then, there have been many studies published showing the system delivers very effective therapy and reduces the invasiveness of traditional implantable cardioverter defibrillator implants by eliminating the leads to the heart. Instead, the system uses a lead placed under the skin of the chest over the heart, eliminating transvenous leads or the need for a lead management later on. About 40% of ICD market today is composed of cardiac resynchronization (CRT-D) systems with pacing. Of the remaining 60%, Borsheim said between 30 to 50% would benefit from the subcutaneous ICD therapy if they do not have any need for pacing. It only requires two very small incisions with no need to create a pulse generator pocket. The subcutaneous systems is developing the WISE CRT system, the first endocardial leadless CRT pacing system. It uses an electrode about the size of a large grain of rice that is implanted inside the wall of the left ventricle using transcaster delivery. A wireless ultrasound transducer is surgically implanted between the ribs to send ultrasound energy to the electrode, which converts the waves into electrical energy for pacing, eliminating the need for a battery or lead wire, allowing the device to be very small. This works as an adjunct advice device to work in combination with an existing connected pacemaker, ICD or CRT, and the external part is charged uh, periodically from outside. The conventional system senses the right ventricular pacing and can work with the wise system to synchronize the left ventricle. So this is another innovation of cardiac resynchronization without leads. Another innovation, the new PACE subcutaneous string implantable cardioverter defibrillator in development, eliminates the implant of a CAN unit in a pocket, as all the components, battery and leads are incorporated into the single cable-like device. This is the external defibrillator and the wires without no intracardiac units. After finishing speaking about the wireless devices, we speak about the new advances in ablation technology. HeartLight was granted FDA clearance in 2016 for its laser ablation balloon technology indicated for pulmonary vein isolation to treat atrial fibrillation. The system consists of a compliant balloon that sits in the ostia of the pulmonary veins, and a laser inside the catheter can be rotated around to ablate the tissues. It also has a camera inside the catheter to offer direct visualization of the ablation and localization of the location of the laser, eliminating the need for electromapping systems and cutting procedural time. The lesions are created within 20 to 30-second ablation. About 25 ablations are needed to isolate a pulmonary vein with lesion overlap. The combination of the balloon camera and variable energy steerable ablation is believed to be able to eliminate the interoperator variability in ablation procedures. After this picture, I found another more innovation in the balloon. The balloon can uh, cause burn in half of the unit of the balloon and even in the middle only. So this is the cryoballoon ablation compared to the radiofrequency ablation that we used before. A late-breaking Heart Rhythm Society trial highlighted a first-in-human study for the Biosense Webster radiofrequency balloon catheter in treating patients with atrial fibrillation. The 39-patient Radiance study showed it could uniformly achieve pulmonary vein isolation in all patients without the need for touch-up with a focal ablation catheter. The system uses a balloon that is lined with several electrodes. The energy level for each electrode can be tailored to prevent damage to the neighboring nerves or the esophagus. Next, after all this, a new technology in lead extraction. One of the biggest safety concerns in removing all the device leads is the possibility of tearing the superior vena cava. This requires immediate emergency surgical repair to stop the bleeding, and the complication currently has a 50% mortality rate. However, spectranectics bridge occlusion balloon introduced in 2016 offers a new safety net during procedures, allowing rapid inflation of an intravascular balloon to seal the tear and allows the surgical team time to prep and perform a repair without fear of the patient bleeding out. It means that during removal of the catheter, if the superior vena cava is teared or ruptured. They put balloon to occlude the superior vena cava till the patient is introduced into open heart and the repair of the superior vena cava occurs. The device is created with saving about 20 lives. So this is also a new technology. Now we come to replacing Holters with wearable and implantable devices. I know this since more than 1 year. The Holter can be introduced subcutaneously without surgery or operating room subcutaneous by injection. Vendors with simple small wearable stick-on Holter monitors that eliminate the need for a bulky belt or worn device and the placement of multiple wire leads on the patients. These new devices offer a less expensive, even disposable option to traditional durable Holter monitoring. Some vendors offer the device themselves, others offer the device in connection with monitoring services. Another monitoring technology are the implantable cardiac monitors from Biotronic and Medtronic and St. Jude. Medical offer monitors which are placed subcutaneously in the chest using a simple fast in-office procedure. Medtronic device is of small size which can easily be inserted under the patient's skin. This is also one of the new innovations. Subcutaneous implanted Holter by just injection without need for operating room. This is example. Replacing Holters with wearable and implantable devices. Reveal atrial fibrillation study showed implantable cardioverter units used for long-term 24-hour-a-day monitoring detected a high incidence of atrial fibrillation in patients previously diagnosed but suspected to be at high risk of atrial fibrillation and stroke. The study found that at 18 months, continuous monitoring with either the Medtronic Reveal or the Reveal link resulted in an atrial fibrillation detection rate of 29% among previously undiagnosed high-risk patients. After we spoke about the Holter, we speak about another point, new electromapping system. For years, the electrophysiologic mapping systems market was dominated by Biosense Webster and St. Jude, but there were complaints from EPs, doctors, that there was little progress in advancing the technology to overcome some of its limitations. This changed in 2014 when Boston Scientific launched the Rhythmia mapping system. At Heart Rhythm Society 2017, they updated the Rhythmia HD was launched. The system can show lower voltages than on previous generation mapping systems. It uses a 64 electrode basket caster to create very detailed high density electro maps with as many as 50,000 points. This is the multi-electrode uh, caster, and this is the system. A new technology that may offer a big reduction in mapping and the procedural times, high resolution imaging and mapping systems. It uses a basket caster with 48 electrodes combined with 48 tiny ultrasound transducers. The basket can be manually rotated around inside the atrium to rapid paint a very accurate combined electro and anatomical map simultaneously in about 5 minutes. So this is another new technology. Improvement in mapping. Despite exponential improvements in mapping and ablation technology, the success rates of caster ablation for certain arrhythmias such as persistent atrial fibrillation remain suboptimal as compared with that conditions with high success rates with caster ablation. The AVNRT is very successful, but persistent atrial fibrillation is less successful, such as atrioventricular nodal reentrant tachycardia, our understanding of the mechanism underlying persistent atrial fibrillation is incomplete and continues to evolve. Invasive rotor mapping, focal impulse and rotor modulation using the RISM view system was one of the first commercially available electrogram mapping systems that demonstrated the existence of drivers of atrial fibrillation in the form of rotors and focal sources in humans. The authors used multi-electrode basket casters to map the atria and proprietary computational algorithms to generate maps, ablating at the site of local rotors or focal impulses. Observational single center that data from the authors demonstrated two sources of drovers per patient, 70% rotors, 30% focal, that were stable for several minutes. Ablation at these sites resulted in the termination or slowing of atrial fibrillation in 86%. I remember Hasager innovated this rotor theory. Another technology in the EP laboratory using magnetic resonance to guide ablation. Magnetic resonance is redesigning devices to make them safe for use in magnetic resonance imaging environment to perform magnetic resonance guided ablation procedures. Magnetic resonance offers many advantages over X-ray angiography and the traditional mapping systems. It can image without any radiation, eliminating the need to wear heavy protective aprons. Second, unlike angiography, it can image soft tissue and visualize the tissue response to ablation when a scar forms, allowing EPs to see the electrophysiologists to see the pattern and effectiveness of their ablation points and patterns. This is the use of magnetic resonance in the EP lab. A company announced the signing of a commercial agreement with Hague Hospital in Netherlands. Also, new technology, use of ultrasound guidance in electrophysiology lab. Of course, since a long time we use intracardiac ultrasound, but they invented smaller units that can be used. Two vendors have developed lightweight, compact cart-based ultrasound systems that allow high-quality intracardiac echocardiography and the transesophageal echo in the EP or Caster lab. Both systems offer many of the features of premium echocardiography systems. Siemens released its new Acuson compact ultrasound system. Another technology, saline enhanced radiofrequency ablation, may be an effective method to treat ventricular tachycardia. A pulsed field ablation successfully treats atrial fibrillation. A new clinical trial effectively uses pulsed field radiofrequency energy to treat patients with persistent or paroxysmal atrial fibrillation. Non-invasive radioablation offers long-term benefits to high-risk heart arrhythmia patients. Treating high-risk heart patients with a single high dose of radiation therapy can dramatically improve the ablation procedure. At the end of the talk, we present the ECG. Apple can record your heartbeat and rhythm using electrical heart sensor on Apple Watch Series 4 and 5 and 6, and then check the recording for atrial fibrillation. The technology and the program is not available in some countries, so it is still progressing. You can buy a watch to record the ECG, or you can put your fingers here and show the rhythm and send it to the doctor. Two latest generation smartwatches and their chargers resulted in no electromagnetic interference in patient recipients under either nominal or worst case scenario programming, suggesting the safety of their use by these patients. So this is another improvement in electrophysiology world. Last is the cardiac contractility modulation. This was presented by Professor showing the implantation of a pacemaker that stimulates the myocardium twice, two spikes in systole. So this can enhance or improve the contractility used in patients with heart failure ejection fraction below 25%. It can really improve it. Cardiac contractility modulation. The unit can be implanted even if the patient is having another pacemaker on the other side. So in summary, the advances in device electrophysiology, new dual chamber leadless pacemaker, Biosense Webster multi-electrode balloon radiofrequency ablation catheter, subcutaneous ICDs, and first endocardial leadless CRT pacing, improved ablation technologies, replacing holters with wearable and implantable devices, Medtronic Reveal remote monitoring, new electro mapping systems, magnetic resonance to guide ablation procedures, many offers many advances over X-ray angiography, ultrasound guidance in the EP lab, Apple Watch tackling an ECG with ECG application and programs, and lastly, cardiac contractility modulation. Thank you. I will put this video on my channel on YouTube, Samir Rafla. It will be available to free to be downloaded. Thank you.